everyone, this is Dr. Nika Taloma, and today we are going to discuss about complications in antepartum of pregnancy, and we are going to discuss specifically infections during pregnancy. So first, we'll start with torch infections. These are a group of infections. It's actually an acronym wherein letter T stands for Toxoplasmosis, O, others, specifically hepatitis A, C, and Syphilis. R is for rubella, C is Cytomegalovirus, and H, herpes simplex virus. So for assessment, what are the different things that we will be able to see for cases such as this? We have influenza-like symptoms, para kang nagkakaroon ng symptoms ng flu. You'll have fever, body malaise, easy fatigability, muscle pains. Okay, this may also be manifested by a rash, lymphedema and lymphadenopathy, meaning nagkakaroon tayo ng pamamaga or mapapalpate natin yung ating mga lymph nodes kasi inflamed sila. Another, we have what we call your sexually transmitted infections. So we're going to discuss here Chlamydia, gonorrhea, Group B Streptococcus, hepatitis B, human papillomavirus, Syphilis, Trichomonas, candidiasis, bacterial vaginosis, HIV. So here we can see in our assessment findings that the patient may be seen to have a previous sexually transmitted infection. And in the history taking, we will be able to take note that this patient may have had numerous sexual partners. So the more partners that this patient have, it means the more din yung chance niya of having sexually transmitted infection. The use of intravenous drugs is also one of the risk factors, as the use of IV drugs may mean sharing of needles. So, ano yung mga complications natin na pwedeng makuha because of infection? So, we have PROM, so that stands for premature rupture of membranes. Hindi pa kabuanan ng nanay, pero pumutok na ang panubigan niya. Next, associated with that as well is preterm birth, and pwede rin po pagkapanganak ng baby, meron na siyang systemic fetal infection or tinatawag nating sepsis. So, what is the pathophysiology of our sexually transmitted infection? So, what we need to take note here is that this may be acquired through sexual intercourse. What else? Sharing of needles, body fluids. If we also eat undercooked meats, pwede po natin makuha ito. Infected cat feces in the litter box, yung tae po ng pusa. So specifically yan ay for toxoplasmosis. Now take note, most of these infections may cross the placental barrier, meaning it can already infect fetus and may cause congenital anomalies or birth anomalies. So they may also acquire the organism during birth or labor at the birth canal, and this may cause also infertility and sterility to the mother. Okay? So, ito yung pathophysiology niya, and we're going to talk about them one by one, starting with toxoplasmosis. So, toxoplasmosis is nakukuha natin ito by being exposed to the cat litter. So kapag buntis, mas maganda, hindi muna natin sila papalinisin. Kung may mga alagang mga pusa, huwag muna sila maglilinis sa litter kasi ang tawag natin dun sa lalagyan ng tae ng pusa. So ano yung mga manifestations dito? We have chorioretinitis. So the eyes, the retina of the eyes are affected. Pangalawa, hydrocephalus. There is enlargement of the head of the fetus. This is because of the accumulation of cerebrospinal fluid. So, yan yung gusto nating i-take note. We will be able to prevent this because it will cause abnormality in the development of the fetus. Okay? So, next is intracranial calcifications. Pag nakikita po natin yung mga kulay puti, those are called our calcifications. Okay, and in the calcifications, this will cause abnormal brain development in the fetus. Okay, so next we have others. So starting off with syphilis. So for syphilis, You have to take note, class, that meron tayong tinatawag na 2 types of syphilis in babies, specifically those who were affected by their mothers. So we have early syphilis occurring at 2 years old or less than 2 years old. We also have what we call your late syphilis. So late syphilis occurring greater than 2 years old. Ano ba yung mga symptoms for early syphilis? We have snuffles. Okay, this is manifested by this, nakikita natin sa face ng bata. Okay, maculopapular rash sa palms and soles which causes desquamation. Pag sinabi nating desquamation, ito yung pagtutuklap-tuklap ng ating different parts of the body. We also have periostitis. So makikita mo yung bone, mali yung development ng ating bone, nagkakaroon ng abnormal bone development. And then as mentioned earlier, aside from that, meron din tayong tinatawag na osteochondritis. We have chorioretinitis and congenital nephrosis. So when we talk about congenital nephrosis, ito po naapektuhan yung kidneys ng infant or fetus born with syphilis. Okay, now, late syphilis naman, pagdating po ng 2 years old, we have to take note that ito yung mga symptoms naman nila, Hutchinson teeth. So, pag nakikita natin, iba irregular ang shape ng teeth nila as compared to the normal. We also have Cloton joints, Saber shins. Ito po yung shin na tinatawag natin, yung harap ng anterior portion of the leg. So, as you can see, there is a deformity. So, yan yung ayaw sana natin na mangyari. So, there is a deformity, Saber shins. And then we have saddle nose. So, this is how it looks like. Osteochondritis and ruggeds. So, ruggeds, ito yung mga abnormal fissures or cracks na nakikita natin sa face ng patients with syphilis. So, what do we need to take note about syphilis is that all pregnant women should be screened for aside from syphilis, with hepatitis B surface antigen. So, hepatitis B immune globulin can be given to prevent infection for both mother and baby. So, that is for hepatitis naman. Okay, for rubella, letter R, what we need to take note here is that ito yung mnemonic BCDMPP. So, blueberry muffin spots. Pag nakakita kayo ng ganito, alam niyo pag kumain kayo ng blueberry, di ba meron siyang parang mga blue na dots? So, we call that blueberry muffin spots. We also have cataract. Bata pa, nakikita niyo yung white portion, class. So, bata pa yung baby, nagkakaroon sila ng cataract. That's why it's called congenital because at birth, it is already present. Next is deafness. So, hindi makakarinig yung bata. Another is microcephaly. Maliit yung ulo niya as compared to hydrocephalus. Micro means small. Ceph means the brain, cephaly. And then we also have patent ductus arteriosus. Okay, at this portion, meron pa rin connection ang ating aorta with that of the pulmonary artery. So that is a patent ductus arteriosus. This also is manifested with peripheral pulmonary artery stenosis. Okay, one of the symptoms din. Now, rubella titer should be drawn at first prenatal visit. Okay, rubella titer should be drawn at the first prenatal visit. And rubella titer that is 1:8 provides immunity. So pag nakita natin sa rubella titer that it is 1:8, this means that immunity is provided. So rubella vaccine is offered to postpartum women before discharge, should not become at least 3 months after vaccination, should not be given. So yun yung kailangan nating tandaan. Should not become pregnant. So for example, nagpabakuna ang mother ng rubella ngayon, dapat hindi sila pwedeng magbuntis within 3 months from the vaccination because this may develop into a torch infection specifically for rubella. Okay? Pero halimbawa, pag nagka-rubella ang nanay during pregnancy, postpartum, after niya manganak, i-offer natin sa kanya ang rubella vaccination. Okay, next we have what we call your Cytomegalovirus. Ang mnemonic naman natin dito ay MIMPS, MIMPS. So, ano yung mga manifestation natin for Cytomegalovirus? So, we have microcephaly, malit yung ulo. Intrauterine growth retardation, IUGR, intrauterine growth retardation. Ibig sabihin, nasa loob pa ng ng uterus ang baby, hindi na siya lumalaki. Aside from that, aside sa physical retardation niya, meron ding mental retardation. And we have your periventricular calcification. So, yung mga puti-puti na yan, these are what we call your calcification. And meron ding deafness ang bata with Cytomegalovirus, or we call that your sensory neural hearing loss. So, nakakatakot, diba? During pregnancy, hindi talaga pwede magkaroon ng infection sana ang mother because this may lead to a lot of complications to the newborn. So, take note class, for our cytomegalovirus, there is still no effective therapy. It has the highest maternal infection at age 18 to 35 or 15 to 35 and is usually asymptomatic. So, yun yung nakakatakot. Asymptomatic siya class pero yung effect niya sa bata, grabe. Okay? So, we call this your cytomegalovirus. Okay, so aside from that, ito yung ating parang mnemonic. Gusto ko kasi mga ganito para madaling matandaan. So sabi niya, most newborns with congenital CMV are asymptomatic, but as many as 15% will develop progressive hearing loss. Sabi ng bata, what? Hindi niya marinig, diba? Kasi nga nagkaroon na siya ng hearing loss. Aside from that, approximately 10% of congenitally infected newborns will have symptoms at birth, such as chorioretinitis, so yung mata niya. Ano pa? Small size for gestational age kasi nagkaroon siya ng intrauterine growth retardation or IUGR. Microcephaly, maliit yung ulo niya. May rash din siya. Petechia purpura jaundice, kaya yellow siya. Ano pa? Hepatosplenomegaly. Yung liver niya lumaki na. Pati yung spleen, pati yung spleen niya lumaki na. So what's the treatment? For neonates, we are going to treat them symptomatic. So treatment with ganciclovir. So that is a type of antivirus. Kasi nga virus ito, di ba? Antivirus. So may protect against hearing loss and developmental impairment. So, wala pa talaga tayong pinaka-effective na therapy for this, but we treat the infection in order to prevent the possible complications. Okay, next we have H, herpes simplex virus. So here, makikita natin for the first week, if it is not treated, makikita sa baby, they have disseminated intravascular coagulation or nagde-develop to into shock. On the week 2, skin, okay, vesicular lesions. Makikita natin yung mga lesions niya. Meron siyang keratoconjunctivitis sa eyes. Okay? And week 3, we have encephalitis. Meron ng inflammation sa brain niya. So, take note class, nakakatakot, diba? These are torch infections. So, they may appear as simple infections, pero pag lumabas ang baby, and if they are greatly affected, kawawa naman sila. Okay, now let's move on to our sexually transmitted infections. Here we have the summary of sexually transmitted infections. So summary muna tayo, isa-isahin natin, and then later on, we'll talk about each of the disease one by one. So, syphilis is caused by the microorganism Treponema pallidum. Ang mnemonic ko dyan is TP. Syphilis, Treponema pallidum. Okay, what are the signs and important features? So, for primary syphilis, we have a painless chancre. So, makikita natin yan mamaya, painless chancre. And then, secondary, we have rash sa palms and soles. And tertiary, gummatus, not infectious. Ito na, not infectious na siya sa tertiary, okay? Pero pag primary, it is infectious. For investigation or laboratory test, we use a dark field microscopy kasi dito lang natin makikita yung structure ng ating Treponema pallidum na microorganism. Direct fluorescent antibody, PCR, and treponemal enzyme link immunoassay. So the management is letter P, penicillin. Okay, madali lang gamutin. Penicillin ang gamot ng syphilis. Gonorrhea, on the other hand, is caused by Neisseria gonorrhea. So, madali lang tandaan yung causative agent at saka yung sakit kasi magkapareho sila ng pangalan. So, it causes pelvic inflammatory disease, PID, pelvic inflammatory disease. So, ophthalmia neonatorum on neonate, ibig sabihin bagong panganak, ophthalmia, eyes. So, meron siyang effects sa eyes ng bata kapag hindi nagamot. And also, reactive arthritis. Masakit ang kasukasuhan. So, this is being tested using a smear gram stain culture ng microorganism, and PCR, polymerase chain reaction. And this is managed with the antibiotics ceftriaxone or cefixime. Next is, we also have what we call your chlamydia. This is caused by Chlamydia trachomatis. So, madali rin lang tandaan kasi magkapangalan yung microorganism and that of the disease. Class, take note, this is often asymptomatic. Ano ibig sabihin ng asymptomatic? A means absence. Absence of symptom. Wala kang makitang symptom commonly. Pero, pag mayroon kang makitang symptoms, these are symptoms of your pelvic inflammatory disease. So, also for this, it is being assess using the polymerase chain reaction to detect for the microorganism, and culture is the gold standard. Ang treatment natin is also an antibiotic. That drug category is called macrolides or tetracyclines. Okay, so next we have genital herpes by herpes simplex virus 2, which is most commonly caused by HSV2. This will cause painful genital herpes. So ito naman yun. Okay, painful genital herpes ulcers could recur by spreading through the peripheral nerves. So detection of virus. So, meron tayong oral kasi na herpes, meron ding genital. So, sa oral, ganito yung itsura niya, class. So, detection of virus in a swab of the lesion or PCR. Saltwater bathing, and ang treatment is antiviral. Tawag natin dyan ay acyclovir. Last is the genital warts, which is caused by human papillomavirus, HPV. Ano makikita natin? Warts naman. Commonly found in the external genitalia. So sa labia majora ito. Pwede rin sa anus. And this is associated with cervical cancer. So ito yung type ng infection, class, that is associated to cancer. So ano ang assessment or laboratory test natin? Clinical. Ibig sabihin pag clinical, makikita mo, kitang-kita mo na agad. Tignan mo lang upon inspection, you can already see na wart siya. Next is screening and exclusion, and of course, we have what we call biopsy. Ang treatment natin, since this is also a virus, we give them antivirus drugs. So, podophyllin extract and vaccine. Meron po tayong vaccine for human papillomavirus. Okay, so this vaccine is one of the vaccines that can prevent cancer. So, what cancer? Cervical cancer. Okay, that is the summary, class. Now, let's discuss it one by one. Ito yung gonorrhea. Sa Tagalog, ang tawag natin dito ay tulo. It is a sexually transmitted bacterial disease involving the mucosal lining of the genitourinary tract. Okay, so, rectum and pharynx. And it is caused by Neisseria gonorrhea. Okay? So, ibig sabihin kasi ng galing ito sa Greek word na gon, it means semen, ria, ibig sabihin flow. Parang tulo, di ba? Seminal flow, gonorrhea. Okay? So, the incubation period for gonorrhea is 3 to 21 days. Ibig sabihin, pumasok ang bacteria sa katawan mo, hindi mo na makikita ang symptoms kasi nag-incubate pa siya. And then after that, magpapakita na ng symptoms. So, take note, your Neisseria gonorrhea, class, they do not survive outside the body. So, it is susceptible to temperature that are extreme and to drying. So, transmission does not occur through skin-to-skin contact or through contact with contaminated agents. But take note, it will remain communicable as long as the organisms are present in secretions and discharges. So, tingnan nyo to, class. It does not survive outside the body. Kaya kapag na-dry na yung seminal fluid, it will be readily killed. So, also by an ordinary disinfectant. So, what is the mode of transmission? Sexual contact, kaya nga siya sexually transmitted infection. Ano pa? Childbirth. Pagkapanganak at infected si mother, magkakaroon ng chance na ma-infect yung baby through childbirth. Okay, so take note, class. For male, 5% are asymptomatic. What is the symptoms seen? So, meron tayong white or yellow or green discharge that is associated with burning urination. Masakit yung pag-ihi niya. And frequency of urination, mas mabilis yung, mas madalas ang pag-ihi niya. So, prostatitis, inflammation of the urethra, rectal infection is common in homosexual naman. So, prostatitis, pati yung rectum affected for those who are homosexual. Okay? So, yan, sa lalaki, ganyan ang itsura niya. Burning urination daw. Okay, and urinary frequency, ihi sila ng ihi. Sa babae, ganito naman ang itsura niya, class. Yan yung tulo na tinatawag. And meron silang burning sensation also in the genital area. Ito is, we are visualizing the cervix. So, gumamit ka ng vaginal speculum. Pagtingin mo sa cervix, ganyan yung itsura niya. For this portion, makikita natin what happens upon exposure to the microorganism. So, sa lalaki, it will infect the epithelial surface of the genital tract and the urethral epithelial cells, which will now reach the prostate and the epididymis. So, magkakos na yan ng infection. For the female, upon exposure to the microorganism, it will also infect the epithelial surface, reaching the cervix, and then packet siya ng packet pataas, causing pelvic inflammatory disease. So, we have endometriosis, so the lining of the uterus, which is the endometrium, and then salpingitis, inflammation of the fallopian tube. Now, sa bata, what happens? So, if a baby is exposed to the microorganism, it will infect the epithelial surface, which will now cause what we call ophthalmia neonatorum. Ophthalmia, yung eyes, neonatorum, yung bata, and of course also rhinitis. So, this is manifested by lid edema. Nakikita niyo yun, class? Namamaga yung lid niya, eyelids niya. And then, there is bilateral conjunctival edema and then pus, purulent. Pag nakita niyo yung purulent, it means meron siyang nana or pus discharge 2 to 3 days after birth. So, ang mga diagnostic exam na gagamitin natin, gram staining, culture of the cervical smear. So, sa babae, kukuha ka ng sample doon sa cervix niya at i-culture natin yan. So, culture of urethral smear as well. So, how we're going to treat it? We treat them with antibiotics. So, we have the following drug of choice: ceftriaxone, cefixime, penicillin, doxycycline, and ciprofloxacin. Okay? Now, how will you manage gonorrhea? We ask the patient if they have any antibiotic allergy, kasi common yan, di ba? Next is explain to the patient period of communicability. So, we have to take note of that. Kung kailan siya nagiging communicable. Also, class, we have to take note that we have to practice standard precautions. So, kailangan mag-wear ng gloves, proper hand washing, and of course, huwag nyo silang i-chismis. Patient confidentiality. What is seen in the examination room should stay where it is. Yan ang pinakapangit, class, na quality ng isang healthcare worker if they cannot maintain confidentiality. Moist heat is used to relieve pain on the affected side. Okay? Apply moist heat for patients with gonococcal arthritis. For the baby, how are we going to manage it? So, gagamitan natin sila ng ointment, yung Creed's prophylaxis na tinatawag natin. Creed's prophylaxis. So, what do we mean by the word prophylaxis? It means we give this to prevent the infection. Kaya pagkapanganak pa lang, class, ang ginagawa natin, we give an ointment kaagad. So, what is that ointment? It is silver nitrate, 1% silver nitrate or any ophthalmic ointment that is recommended. So, pwede dito yung tinatawag din natin na erythromycin ointment. So, pwede siyang alternative other than the silver nitrate. Okay, what are our preventive measures? So, anong turo sa atin ng Center for Disease Control or CDC? We have ABC. Anong A? Abstinence, di ba? Abstinence. Okay, so, abstinence, be faithful, and the use of condom. Okay. Meron din tayong 4C ng DOH. Ano yung 4C ng DOH? Condom, contact tracing, counseling, and compliance. Condom. paggamit ng condom kasi yan ang pinaka-effective, di ba? Contact tracing, alamin mo kung sino ang nakipagtalik sa pasyente na nag-positive. Pangalawa, counseling. I-counsel mo rin sila kung ano ba dapat ang kanilang gawin para maiwasan ito. And letter C, compliance. Alamin mo kung iniinom ba nila yung gamot nila or iniiwasan na nila ang pakikipagtalik sa maraming tao. Okay, and 100% proper condom use. Dapat alam nila kung paano tamang gamitin ang condom. Okay, ayan, practice safe sex. O ito daw unsafe sex kasi mahulog na sila. Ganyan ba ang safe sex class? Of course not. Ibig sabihin ng safe sex, hindi ka magkakaroon ng multiple sexual partners and at the same time, you use the condom. So yung tinatawag nating measures kanina, always abstinence, letter A, B, be faithful, C, condoms. Okay, let's move on to the next infection. This is called chlamydia. So when we talk about chlamydia class, this is the most commonly sexually transmitted disease. Pag tinanong kayo anong pinaka-common, ang answer is chlamydia, and ang second most common, the answer is gonorrhea. So it is caused by Chlamydia trachomatis. So ito, cervix ito ng babae. Pag inopen natin yung, pag naglagay tayo ng vaginal speculum at i-open natin, makikita nyo yan. Ganyan ang itsura ng chlamydia class. Okay, so anong mode of transmissions? Through sexual intercourse. Ano pa? Through childbirth as well. So what are the symptoms for the female? Sa mga babae, dyspareunia. Ano ibig sabihin ng dyspareunia? This means painful sexual intercourse. Ano pa? There may be a slight vaginal discharge associated with abdominal pain. Another is bleeding after sexual relations or between menstrual periods can be also a sign of your chlamydia. Chlamydial infection of the cervix can spread to the rectum. Now, ang nakakatakot for our chlamydia class, it may cause sterility for both men or women. Pwede silang mahirapan magkaroon na ng mga anak later because of this infection. Ano pa? Prematurity. So, pwedeng may panganak yung anak nila na premature kapag merong ongoing infection ang mother na chlamydia. Stillbirth or abortion. Remember yung gonorrhea class? So, it's almost the same. Okay, so for chlamydia, ano yung mga pwedeng maging effect nito sa mga newborn baby? So when babies are infected at birth, an eye disease called trachoma develops. So trachoma is the leading cause of non-traumatic blindness in humans worldwide. So pagkapanganak ng baby, if we did not treat or we did not give prophylaxis, the baby may develop trachoma and later on will cause blindness. Okay? So, how are we going to diagnose this? So, pagka-open mo, maglagay kang vaginal speculum, makita mo, ganyan yung cervix ng nanay, kuha ka ng swab, iswab mo from the site of the infection, and then you are going to culture the aspirated material or the swab material. Okay, how are we going to treat this class? Okay, our drug of choice is called doxycycline, but we can also give azithromycin. So these are antibiotic na malalakas na pwede natin gamitin to treat chlamydia. So for preventive measures, abstinence, ibig sabihin yan pa rin ang pinaka-effective. In order for you not to get a sexually transmitted infection, eh huwag kang makipag-talik, di ba? And another is monogamy. So when we talk about monogamy class, iisang partner lang. And dapat yung partner mo is also monogamous. Siya lang partner mo, pero siya pala, marami pala siyang ibang partner. So that would be useless, di ba? Wala tayong na-prevent. Okay, next is 100% proper condom use also. Next, we have syphilis. Okay? So, ano ba ang definition natin ng syphilis? This is a chronic, infectious, chronic, ibig sabihin matagal, infectious, nakakahawa. It's a sexually transmitted disease that usually begins in the mucous membrane and quickly becomes systemic. So, mauuna muna siya sa oral mucosa or sa genital mucosa. It is caused by Treponema pallidum. Diba sabi ko kanina, class STP. Syphilis, Treponema pallidum. So, Treponema pallidum, spiral siya na microorganism class. Ganyan ang shape niya. It passes through the mucosa and then it can also pass through the placenta. Kaya, Class, kapag syphilis infected ang mother at buntis siya, it will be passed through the placenta at ma-affect din ang baby natin. Kaya merong mga pinapanganak na baby with congenital syphilis. So for Treponema pallidum, ito yung mga manifestations natin, okay? So we have here, meron tayong chancre, may discharge din. Ano ba yung mga sources of infection for syphilis? Discharge from concealed lesions, semen, blood, mucus discharges from the nose, eyes, or genital tract. So yan, nose, yan meron dito, meron sa genitalia, sa semen, and then, sa nasal discharges and sa blood, okay? So we have contaminated articles can also be source of infection or mode of transmission. Congenital, sabi natin it passes through the placenta, so pwedeng maapektuhan si baby. And of course, sexual intercourse. Now, take note class, there are progressive development of stages in syphilis, from primary to secondary to latent syphilis to late syphilis. It is called the great imitator because so many of the signs and symptoms are indistinguishable from those of other diseases. Alam mo yun, parang great imitator kasi hindi mo akalain agad-agad na syphilis kasi meron ka pang ibang sakit na maiisip, okay? Now, first, we have what we call your primary syphilis class. This is characterized by one or more chancre that erupt in certain areas. So what I want you to remember, the chancre will look like this, firm, round, small, and painless, tsaka moist. So, yun ang gusto kong tandaan, syphilis, painless. Parang ganon, painless, ganon. Syphilis, painless. So, wala siyang pain. So, these chancres are usually painless and starts as a papule and then erode. Kaya mukhang na-erode siya. Parang pumutok. Usually invisible to women kasi sa cervix na siya makikita. Okay, next, we have saan ba na agent? Ito yung mnemonic natin. Saan ba natin makikita? So, this chancre usually disappear after 3 to 6 weeks without treatment. Mawawala rin siya. Pero saan natin pwedeng makita yung chancre? Sa anus, genital, eyelids, nipples, and tonsils. Kaya yung mnemonic natin, agent. Okay, now, let's move on to secondary syphilis class. Okay, when we talk about secondary syphilis, during this stage, the infection starts spreading over the entire body. So, ano makikita natin? We have dermatologic findings and lymphadenopathy that signifies progress to this stage. So, usually, symptoms will appear 1 week to 6 months after appearance of chancre. So, 1 week to 6 months after appearance of the chancre. Ganon katagal. So, after 6 months, saka lang natin makikita itong manifestations of secondary syphilis if hindi natin treat yung primary syphilis. So, ang kanyang manifestation, dermatologic, it could look as macular or papillar. Ibig sabihin ng papillar, meron siyang umbok. Pwede rin postular, may nana, or nodular. But what you need to take note is, pare-pareho usually sila ng size, well-defined and generalized, at hindi siya makati. It is not itchy. Okay? So sabi natin kanina, pwede siyang nodule, papule, meron siyang elevation, macule, flat lang, pustule, merong nana. Okay, so these are other features of our secondary syphilis. More of dermatologic siya. So it may affect the entire body, pwedeng sa palms or soles. And in dark skin individuals, makikita din natin to as reddish or brownish spots. Yan ang secondary syphilis. Okay? Another manifestation of secondary syphilis is what we call patchy alopecia. Ang alopecia, ito yung nalalagas yung hair. Patchy kasi parang hindi siya lahat. Meron lang certain patches na nalalagas yung hair niya. So this may include loss of the outer third of the eyebrows, which is temporary naman. Another is we have also what we call your mucus patches. So makikita mo, pag tinignan mo yung mga mucous membrane niya, may mga patch ka na makikita. Okay? So next, we have also for secondary syphilis class, we have what we call your condylomata lata. Condylomata lata are described as large, grayish lesions found in moist areas. So pag makikita natin ito yung labia majora, okay, sa anus, So, perineum, vulva, and scrotum, makikita natin yung condyloma talata. These are lesions na large and grayish, which are signs of our secondary syphilis. So, the secondary syphilis may have constitutional symptoms. This means, pag constitutional symptoms, these are group of symptoms class that can affect many different symptoms of the body. Kaya constitutional. So, ano ba yung mga yun? We have fever, lymphadenopathy, sore throat, weight loss, hepatitis, and pruritus. So, these are the different symptoms. So, makikita natin yan for secondary syphilis. Okay, next we have what we call your latent syphilis. Pag sinabi natin latent syphilis, the serologic test of the patient for syphilis proves to be reactive. So approximately 2/3 of the patients remain asymptomatic until death. We have here, it may continue 5 to 20 plus years without symptoms, not normally infectious except transplacentally. So pag sinabi natin latent syphilis, meron existing yung infection natin. Pag tinest mo yung blood ng patient, reactive siya of syphilis, but it is concealed or inactive. So does this mean that the patient is just asymptomatic? Yes. So meron siyang infection, may syphilis siya, pero wala lang tayong symptoms na nakikita. So parang mas delikado yun. Okay? Next is we have what we call late syphilis. The signs of this type of syphilis are not associated with the direct effects of the microorganism, but they are complications. So for late syphilis, they are destructive but not infectious. Hindi na sila nakakahawa, pero destructive ang effect niya sa patient. So we have what we call your gamma. Okay, for gamma, this is a type of lesion, hindi na to nakakahawa class. It is solitary, mag-isa lang siya, asymmetric, also painless, and indurated, firm, non-moving tumor. It can be found in any bone, particularly the long bones, skin, and mucus. So, pwedeng ang gamma makikita sa bone, pwedeng sa skin, or any part of the mucous membrane. Okay? Destructive, sabi natin, di ba? Pag hindi na-treat, it may be destructive. So, this is not infectious, pero it is destructive in nature. So, on the late phase, pwede nang kumalat yung microorganism natin sa iba't ibang abdominal organs, to the bone, to the heart, and to the brain. So, yun yung gamma na tinatawag natin. So, what are the tests that we're going to use to assess for a patient with syphilis? So, we have what we call your dark field illumination test, because that is only test wherein we can visualize our treponema pallidum. Calm test. This is serological. Kukuha sila ng blood ng patient natin. Calm test. And then fluorescent treponemal antibody absorption test. Okay, for medical management, sabi natin, ang treatment natin for syphilis is penicillin. That is the drug of choice. But we can also use tetracycline. This is also an antibiotic. And doxycycline to treat syphilis. Now, in treating syphilis, pag nagbigay ka na ng syphilis sa patient nagbigay ka na ng penicillin rather sa patient na may syphilis, pwede siya mag-develop ng Jarisch-Hersheimer reaction. Jarisch-Hersheimer reaction. So this is manifested as fever, hypotension, and musculoskeletal pain. So may fever yung pasyente natin with hypotension, bumababa ang BP niya, associated ngayon with musculoskeletal pain. Okay, ano pa? Tachycardia. Yan, nagtatachycardia din siya. Bumibilis ang heart rate niya. Okay, now, as part of the nursing management, you have to take note class, you have to ask the patient to complete the treatment because not completing the treatment may mean more damage to the patient. So, institute contact tracing, kung sino yung mga nakatalik or na-expose sa pasyente, keep the lesions dry, and check for complications. Take note class, we also have to report these cases to the Department of Health for surveillance. So what are the commonalities for all sexually transmitted infections? Ibig sabihin, lahat ng mga ito, fina-follow natin for any sexually transmitted infection. Number 1 class is the use of the Center for Disease Control's ABC. Yung A, abstinence, B, be faithful, C, condoms. And then yung DOH na 4 C's na sinabi natin kanina, di ba? Condoms, contact tracing, compliance, and there's another C na binanggit na din natin kanina. Same modes of transmission. Pare-pareho naman sila ng modes of transmission which is sexually transmitted. So, and di may coexist. Kung may gonorrhea ka, pwede ka pa rin magkaroon ng chlamydia. Tapos nakipagtalik ka pa sa patient ay sa tao na may syphilis, di pwede ka rin magkaroon ng syphilis. So, those are the things na pinaka-common that we need to know about our sexually transmitted infection. So what I want you to remember are the following. So for example, pag tinanong kayo, lahat ba ng sexually transmitted infections are curable? Okay, the answer to this is false class. Remember, human immunodeficiency virus will lead to AIDS at wala pa tayong cure for AIDS. Identification. What is the most effective way to prevent sexual transmission of HIV or other sexually transmitted infection? Ang sagot, abstinence. Okay. Multiple choice. Penicillin is the drug of choice for what? A. Syphilis, B. Chlamydia, or C. Gonorrhea. The answer is syphilis. Diba? Syphilis, penicillin. O ano to? This is what we call chancre, which is seen in primary syphilis. Okay, next. Syphilis is diagnosed with what? Dark field microscopy. So, nabanggit natin yan kanina. So, what are the two STIs that can be prevented through Creed's prophylaxis? Yung maglalagay tayo ng ointment sa eyes ng baby, either silver nitrate or erythromycin. So, we have your chlamydia and gonorrhea because they both cause ophthalmia neonatorium. Yung chlamydia, it causes trachoma. Okay, so before I end my lecture, I would like you to take note of this. So, ito yung sinasabi natin kanina, di ba? This is from Center for Disease Control. A is abstinence. The surest way to avoid STD is not have sex. Tama nga naman. Have fewer partners. Be faithful. Agree to have sex with one person only. Also agrees to only have sex with you. Next, talk with your partner. So, for staying safe, you have to be tested together. And the use of condoms correctly every time you have sex can help you avoid sexually transmitted infection. And also, pwede tayong magpa-vaccine, especially for those STIs na merong vaccine, such as your human papillomavirus infection, which can also prevent, this vaccine can also prevent cervical cancer. So take note, many sexually transmitted diseases do not have symptoms, but they can still cause health problems. If you test positive, class, it is not the end. Many STDs are curable and treatable, but not all are treatable. All are not treatable, but all are preventable. So you have to take note of that. So you have to remember all those things.